Obesity has become one of the most pressing public health issues in the world, with profound implications not only for individual health, but also for the economy at large. The economic costs associated with obesity are staggering, and they continue to rise as obesity rates climb across various age groups and demographics. While much of the focus has been on the direct health consequences of obesity, including diabetes, heart disease, and certain cancers, the financial burden placed on society is equally significant and often overlooked. The economic costs of obesity are multifaceted, encompassing both direct and indirect expenses. Direct costs refer to the expenses related to medical care, including hospitalizations, treatments, medications, and surgeries. Obesity-related conditions, such as type 2 diabetes, hypertension, and sleep apnea, require long-term management, which involves expensive drugs, frequent doctor visits, and sometimes surgeries or other procedures. This places a heavy strain on healthcare systems, especially when public health systems are involved. In the United States, for example, the Centers for Disease Control and Prevention, CDC, has estimated that the medical costs of obesity amount to billions of dollars each year, with obese individuals incurring more than $1,400 in additional annual healthcare expenses compared to those with a healthy weight. In addition to the direct costs, there are substantial indirect costs associated with obesity. These include lost productivity in the workforce due to absenteeism, reduced work capacity, and premature death. Obesity leads to a range of health complications that reduce an individual's ability to perform their job effectively, leading to greater absenteeism and decreased productivity. Individuals with obesity may also face discrimination in the workplace, which can impact their earnings and career advancement opportunities. This creates a ripple effect, reducing the overall productivity of the economy. In the United States alone, the total indirect costs related to obesity have been estimated to be even higher than direct medical costs, further compounding the problem. Furthermore, obesity exacerbates health inequalities. Those living in lower socioeconomic conditions are more likely to be obese, in part due to limited access to healthy food options, lower levels of physical activity, and limited healthcare access. This leads to a vicious cycle in which individuals from disadvantaged backgrounds face not only higher rates of obesity, but also greater economic costs due to their reduced access to prevention and treatment. The resulting disparities perpetuate poverty, creating an additional layer of economic burden on the community and further straining already overburdened public health systems. The long-term economic impact of obesity is also devastating. As more children and adolescents become obese, the future of the workforce is at risk. Obesity in children is associated with a higher likelihood of chronic diseases later in life, including diabetes and cardiovascular diseases. This results in a generation of individuals who will not only face a diminished quality of life, but will also contribute to an ever-increasing financial burden on healthcare systems. The chronic nature of these conditions means that individuals will require lifelong care, which can lead to even greater long-term costs for both individuals and society. Another issue with obesity is the hidden cost to future generations. When parents are obese, there is a greater likelihood that their children will also become obese, leading to a cycle that continues across generations. The burden of obesity and its associated economic costs can thus be inherited, perpetuating the societal and financial strain for decades to come. Efforts to address childhood obesity have been inconsistent and often insufficient, leading to fewer long-term solutions for breaking the cycle. The food industry plays a key role in perpetuating obesity through the marketing and availability of highly processed, calorie-dense foods that are often cheaper and more accessible than healthier options. This has contributed to an environment in which poor dietary habits are normalized and individuals are encouraged to consume unhealthy foods in excessive amounts. While some argue that the responsibility for obesity lies with individual choices, it is important to acknowledge that the broader economic forces at play, such as the marketing of unhealthy food and limited access to nutritious options, are significant contributors to the obesity epidemic. These systemic issues make it difficult for individuals to make healthy choices, and ultimately, this lack of access results in higher rates of obesity and its associated costs. One of the most concerning aspects of the obesity crisis is the toll it takes on younger generations. In recent years, childhood obesity has reached alarming rates, leading to an entire generation at risk for obesity-related diseases such as diabetes and high blood pressure at much younger ages. The long-term consequences of this trend are dire, not just for the individuals involved but for society as a whole. Childhood obesity is associated with a range of health issues that extend well into adulthood, leading to premature death and an increased need for medical care throughout life. This not only diminishes the quality of life for those affected, but also represents an enormous financial burden on public health systems that must shoulder the long-term costs of these conditions. In terms of the societal impact, obesity contributes to increased healthcare disparities and inequality. Low-income communities are particularly affected, as they often have limited access to healthy foods, healthcare, and exercise opportunities. This, combined with the psychological and physical toll of living with obesity, creates a situation where individuals are often unable to break free from the cycle of poor health and financial hardship. For these individuals, the economic costs of obesity are compounded by a lack of opportunity for better health outcomes, which perpetuates the cycle of poverty and poor health. Despite the clear evidence of the economic and social costs of obesity, efforts to address the issue have often been insufficient. Policy changes aimed at reducing obesity rates have been slow and inconsistent, and public health campaigns have often failed to make a significant impact. While some progress has been made in terms of increasing awareness and promoting healthier lifestyles, these efforts are often undermined by the powerful interests of the food and beverage industries, which continue to push unhealthy products into the marketplace. The reality is that obesity is not just an individual health problem, it is a societal and economic crisis that demands urgent action. The financial costs associated with obesity are too high to ignore, and the longer society delays addressing this issue, the greater the burden will be on individuals, healthcare systems, and economies. Unless substantial efforts are made to address the root causes of obesity, including the availability of healthy food options, access to affordable healthcare, and education about healthy living, the economic toll of obesity will continue to rise, with devastating consequences for future generations.